This is a Rattle and Hum Sports podcast for Thursday, July the 18th, the year 2013. I'm Bryan Houston, and we are talking nutrition, health, and all things medical right now with Mika Bradford, the certified nutritionist, health advisor, pharmacy technician, and writer for Rattle and Hum Sports. How you doing, Mika?
I am doing wonderful. I had a nice little break and got to the mountains and got some cool air and have been refreshed and ready to deal with the hot Texas summer we have now.
Man, I already know I'm not going to like you very much. I'm ready to get away from this heat for a while.
I have to say 12,500 feet above sea level and a rock crawler and above the tree line did some good.
I bet. That sounds wonderful. Well, let's get to business and quit talking about vacations and stuff, because all I'm going to do is get angry now. So we recently had a story come out that had to do with fish oil supplements, and one of the topics, the headline says, fish oil supplements cause prostate cancer. And that caused quite a backlash. Been a lot of criticism of the media for reporting the story in such a way. There are a lot of misconceptions, a lot of wrong information out there. So first of all, tell me what you know about this study, and then try to get us the truth about what is and what isn't with fish oil.
Well, here's the thing, Bryan. First of all, any of the writers or the media outlets that said fish oil supplements associated with increased prostate cancer were completely inaccurate and false in the way they represented that. Because the fact is that the actual article and the study that was done was looking at plasma, phospholipids, fatty acid levels, and its association with prostate cancer risk in a very select trial. So what that means is that they were looking at the lipid levels in blood. It did not ever identify in the study the source of where those omega-3 fatty acids came from. So to be quite honest, those could have been from naturally occurring components in foods, whether it be fish, nuts. It could have been supplements as well. But when you look at the data and the way the study was designed, it doesn't hold a lot of weight when you're looking at how many studies have shown the benefit and positive impact that increased consumption of omega-3s have within reason in conditions not only with prostate cancer in studies from before, but also with heart disease. We also know that increasing your omega-3s has been shown to help with lowering triglycerides and increasing, your good lipids, your HDL. Also, from a functioning standpoint and neurological standpoint, we know how critical it is that the DHA component in your fish oils and omegas is going to help mothers during pregnancy for the development of healthy brain tissue for the infant. So it's unfortunate that many times studies, while they show an association, what they also don't show in this study is the latency or the time period between when the levels of lipids were measured and the time period and when the individuals developed prostate cancer. So there's no correlation. They don't identify the time between the plasma sampling and when the diagnosis was given. So there are a lot of variables with this. And that's probably the most concerning thing for me, is that when you look, you have to put this study in context with other studies that have been done on omega-3s and how the benefit outweighs the risk, just like with any other product we take or with any other activity that we do that can directly impact our health.
Okay, so bottom line is don't stop eating fish. And don't start eating trans fats, right?
Yeah, that's a good takeaway message. And the thing too is that when you look at this, even when in this wonderful professional, Dr. William Harris, who's a PhD and he's internationally recognized as an expert on omega-3s. He also has a company that looks at the analysis of omega-3s in the blood for many hospitals and private facilities. And he just really does a great job in looking at the fact that even if you were to consume 2 fatty fish meals a week, and then you were also taking supplements or one or the other, that your levels still would not exceed what would be considered too much in the plasma with their index and their scoring. So, and then looking also at one of the things that was beautiful that he pointed out in a response to this article that was done about the relationship of the phospholipids and omega-3s in relationship to prostate cancer is that, looking at Japan versus the United States, that even with the World Foundation of Urology, that they show that we have 63 times more, or 63, when you look at it, it's 63 times 100,000 for individuals with white men here in the United States that have prostate cancer, 102 to 100,000 of African Americans, in contrast to looking at only 10 to 100,000 men in Japan. And so the point is, in Japan, the consumption of fish is far larger, far greater. It's like 8 times the amount of what we do here in the States. And so when you're looking at that, that in itself changes the perspective and perception, of what we're doing.
Yeah, numbers alone would bear out that a high fish diet is a good thing.
Absolutely. And, when you look, like what we were talking about earlier, at studies that are looking at everything from helping with the joints and lubricating the joints and decreasing inflammation, and also looking at different eye conditions. I mean, how many ophthalmologists, optometrists now suggest the omega-3s, because the membrane for the eye, is very malleable whenever it has the lipids, and that's what's going to help with fluid and retention and decreasing the ability for drying out. And so it's critical for the membrane of the retinas. And then also just looking at overall, skin, and then helping to, take care of the good cholesterol. So, there's so many positive attributes. And when you look at our daily intake from the foods we eat, it doesn't add up that we're getting enough.
I did see one article on the study that we're talking about, and one of the things that was kind of glossed over was that according to the study, 53% of the people in the study with prostate cancer were smokers. 64% of the cancer subjects regularly consumed alcohol. 30% of the cancer subjects had at least one first-degree relative with prostate cancer. 80% of the cancer subjects were overweight or obese. So to take the leap that omega-3 fats might be give you a higher risk of having prostate cancer with all these other factors involved, that's a pretty big leap.
Yeah, it is. And the other thing, too, that we have to look at is it's not only about a nutrient, but it's about the way the body metabolizes or utilizes those nutrients. And we can see that for some individuals, and I think we've touched on this before in past podcasts, that I can give an individual, let's say, regular folic acid till the cows come home. Mm-hmm. And technically, it should provide support for the nervous system and for metabolism. But if the individual taking it has an issue with the enzyme process that converts that folic acid into the active form, into the final stages or form that the body can use in its most bioavailable state, then you're going to have issues with conversion, not only of the folate, but then all the other processes that are folate dependent. So same thing with B12. We see that where just because you have high serum levels of B12 doesn't necessarily mean that it's being converted. And there are other tests that can look at the byproduct of a buildup of a chemical if you're not having the B12 active and able to utilize it. So, there are many factors that they're not looking at. Just because the levels are high in the blood doesn't mean just like you pointed out, that that's going to be one of the causations. And that's the thing. The study did not show causation.
Okay, very good.
And that's really what we want to look at. And we want to look at any time that we're making a decision to take a supplement and a medication. I mean, my pharmacists still agree on this. We have to look at the big picture. You can't just make a decision on a product based on one study. You have to look at the body of the literature that's available, and then you also have to look at the factors of the people that participated in the study. Because just like with even lab work, you know, we've talked about this, that in your blood work, vitamin D levels will be considered in the normal range at 30 to 100. But if I have somebody that's at 35 and a practitioner says, oh, you're good, you're in the normal range, so don't worry about supplementing more. Okay, so for one person that may seem reasonable, not in my world, but in some situations that may seem reasonable. But if you have a person coming in that's depressed, has fatigue, maybe some chronic pain, has been having history of consistently having upper respiratory infections, and they're coming back at the same rate of vitamin D in the blood work or the same level, then it's a whole different ballgame, because their body burden and what they're presenting with from a nutritional standpoint and health is saying, you know what, this may not be the right amount for this person. And those ranges on many of these tests are just a population-based range where they've taken a subset of people and said, this is what looks pretty normal. But it doesn't tell us what all the other stuff was going on with those individuals when we used them as our baseline or our rule of thumb.
So what are you advising then for a person who is interested in making sure they're getting enough omega-3 fatty acids? Where do they go to get the information that tells them this is the right amount for me?
You know, when you look at some of the different studies and you look at what's heart healthy and considered beneficial, really 600 to 1,000 milligrams of your omega-3s is what's suggested. And what's important, and we have some practitioners and some individuals that if they have severe states of inflammation, or we have a lot of rheumatologists that will have their patients taking up to 4,000 milligrams of omega-3s a day to help because of the beneficial impact and how the body reacts from an inflammatory standpoint. But for the average customer, you know, when you look 600 to 1,000 milligrams is going to be the standard. And the important thing is that when you're looking at fish oils, that, you know, it's just like gasoline, that we can have 6 different manufacturers and their gel caps can look the same or they can be different. But if they look the same, it doesn't mean that the active ingredients are the same. So just like with gasoline, you know, and I use this example frequently, is that I can have a gallon of 3 different types of octane. Well, the weight and the volume is going to be the same, but the active constituents and ingredients isn't. So it's the same thing with the fish oil. So, you know, for all of you who just like to grab the inexpensive and you see it on sale, and it says, you know, 180 gel caps for, you know, $18, and it says 1,200 milligrams of fish oil on the front of it, you really need to read. And many of the companies are getting better about it, but you need to look and say, okay, is that fish oil or is that omega-3s? And if it's omega-3s, how much of the omega-3s is in each gel cap? Because I have some manufacturers that one gel cap is equivalent to 3 of another company's.
Wow. Okay.
So when you're also looking at whether it's taking care of our parents, whether it's our kids, or even for us, you know, and people don't like to choke down a lot of pills. So you want to look at not only am I getting the amount that I need or that makes sense for me, but then also how can I keep my pill count down, you know, and not feel like that I'm choking down horse pills, you know, multiple horse pills a day.
Right. Can you overdose on this? Can you take too much of this?
You know, Dr. Harris, they do have an upper limit, and so my thought is that when you look, I don't know that you could say there's any literature, I'm not aware of negative attributes from a health perspective besides the fact that it can work and decrease the stickiness of blood cells. So one of the concerns is that if you have an individual who is on any kind of blood thinner, or if they are on high-dose aspirin therapy, then they really don't need to exceed the standard suggested amount of fish oils of the 600 to 1,000 milligrams of omega-3s without consulting with their practitioner, because that population of individual, it can make a difference in contributing to helping with lowering blood pressure. But the way that works is that it helps change the viscosity of the blood. I mean, it does a lot of health positive attributes. It provides that. But at the same time, if you already have an issue with bleeding, if, you get cut and bleed easily and it takes quite a while for that bleeding to stop, if you're on any of these other therapies or medications, then you've got to look at the big picture and the function and how much you're going to be taking. Other than that, most individuals, 600 to 1,000, even, up to 1,400 milligrams of omega-3s, it's not going to be excessive. It's just really making sure that you know what you're taking and how it works together, and then working with your doctor. And if they're not aware of the parameters of fish oils and the health benefits, there are many doctors that are these days that are really being proactive. I know the Cooper Clinic here in Dallas has just been carrying the flag for the difference in how the omega-3s impact health issues abroad. So it's been exciting to see that. And they actively do an analysis and look at the omega-3 blood levels in all of their clients and their patients. And so to see that, they've taken that cause on and to support the nutritional and health needs of their patients, pretty cool. So there are doctors that recognize the use and the structure and the function of the omega-3s. And I just think, like with everything else, it's about balance and looking at your individual needs and what you're taking.
Can you get what you need in just your regular diet without having to do supplements?
Here's the thing. It's great anytime that we can get our nutrients from food sources, because, when we were created, that's what it was about. It's about foraging in the fields and fishing and hunting and all sorts of good stuff. But the reality is that depending on your health issues and your diet, with so many people that have so many different food allergies these days, or because we're so accustomed now to the grab-and-go meal plan of being busy and just getting stuff quick, unfortunately, most of us don't get enough of the omega-3s in our diet. And it's possible that when you look at adding, if you're deliberate about the foods you pick, like walnuts and different healthy oils, then you could fashion and create that to an extent if you don't have additional health issues that would require more, because the EPA and the DHA are the constituents that are really key in the omega-3s, and EPA is known for helping to support the body's response to inflammation, and DHA is known for helping with cardiovascular as well as the development of brain tissue and healthy brain volume. So can you go through and you make a deliberate choice to eat fish and to incorporate walnuts? Yes. Now, when it comes to fish, the caveat to that is that where's the fish lived? Mm-hmm. Has it been wild? Is it going to be farm raised? Because there's debates on both sides. If it's farm raised, well, people say, okay, we know what it's been fed and it's in a controlled environment. But it also depends on where that farm is and how much of chemicals from fertilizers and all sorts of pesticides have leached into the ground where the fish are. Then there's the issue of wild, talking about, okay, so we're talking about toxins and PCBs and, what does that look like? So that's why trying to do fish twice a week, fatty fish, is great. But at the end of the day, if you're not going to take the time to plan out your meals and know what your nutritional content is of the foods you're eating, then taking a couple gel caps of fish oil is going to be the quickest quickest route
Okay.
to helping with that.
All right. And finally, as we wrap it up, the takeaways from this concerning articles like the one that we've been talking about, and any other bullet points that you want to share?
I think it's just important that when you're taking ownership of your health, and we all should be in a place where we're doing that now. We should never hand over the keys to the car with something as vital as our health, because that's our future, and that's our ability to be with our families and to enjoy life. I think that looking overall, you need to know that when studies come out, that you've got to be very analytical and look at what was the objective of the study, and not just focus on what it said, but you need to look at what does the study not say. And know that, in the media, all of us, we want people to hang out and look at our website at Rattle and Hum. We want people to listen to our podcasts. It's just a question of, are the other sites, are the other news outlets, do they sensationalize it a little bit more to get your attention, and then it doesn't truly come across as having a level of transparency, in conveying the real message. That's one of the things that I think is important. So you've got to be a thinker, and you've got to look and realize that the headline that you read or hear may not actually be the real deal on what occurred in that study.
Very good. Great advice. Mika, always a pleasure to talk to you. Thank you very much for coming on with us today, as always.
Absolutely, Bryan. It was great visiting with you. We'll talk to you soon.
Very good. Mika Bradford, the certified nutritionist, health advisor, pharmacy technician, and writer for Rattle and Hum Sports. Again, this is a Rattle and Hum Sports podcast. I'm Bryan Houston. Thanks very much for listening, and we'll talk to you next time.